Hey, Tina.
Hi, Leah.
We got a little change up going on here.
Yes, we do. You want to explain that? I thought we were
Yeah.
supposed to talk about constipation and diarrhea.
Right. Yeah. We were supposed to discuss bowel changes as our third in this series of side effects. And that turned out to be a really, really long episode. So I think we're going to end up doing bowel changes as its own category, as its own pod, and talk about something different today.
That sounds reasonable. The gut deserves its own pod.
It does. It deserves the respect.
That's right. It's the center of our health, right? The
Yeah.
gut. All right. So we'll do that. And today we're going to talk about sleep disturbance.
Yes, because I think this is very important. Once you've received a cancer diagnosis, sleep disturbances can happen even once a person completes treatment. I mean, they can persist. So I think this is a really, really important subject.
Yeah. Yeah. I think that it's really important because I think there's a lot of ways of going about this that are very effective. And it's really common. I mean, up to a third of people who have been through cancer treatment have lingering sleep disturbances afterwards for some time. So that's a lot of people.
I read like 40% of patients after treatment continue to have problems for 5 years out.
And you know what happens? They stop reporting it because it becomes normal.
Exactly. So let's talk about it.
Yeah.
So I'll start by just kind of talking about the different stages of sleep. Everybody probably has heard the word sleep cycle. So there are 4 stages to a sleep cycle. Those cycles last about 90 minutes. And throughout our sleep, over the 6 to 9 hours that a person may sleep, ideally, we cycle through about 4 to 6 sleep cycles. So the first stage is when you kind of start to drift off to sleep. So that stage from wakefulness to light sleep, you start to relax, heart rate slows, breathing slows. And then you go into stage 2, which is more like that light sleep to deep sleep stage. And then your brain waves start to slow. And this is where most of the sleep time is spent. Stage 3 that's the stage you need in order to feel like you're rested.
Mm-hmm.
So that one is where you're at your most relaxed. And if you're woken up during stage 3, then it's kind of hard to wake up. So we all kind of know that you're startled in the middle of the night and you're just groggy and disoriented. That's stage 3. REM sleep is the last stage that I'll talk about. And that one is rapid eye movement. It's not as deep of a sleep. That's the stage when you're dreaming. And as you age, you spend less time in this stage.
The watches that people wear, right, to track activity and count our steps and that, a lot of them have a sleep device on there that tells you the stages of sleep that you go through. And I think that those can be really useful for helping you understand if you're reaching kind of that stage 3, deep sleep, restful sleep. I have a good story about this. I went home one year for Thanksgiving, and I have a relative who will remain unnamed and sleeps very well normally. And I was looking at the person's phone and looking at their sleep cycle. I was like, man, you sleep really well. And this is someone who's older, over 75. So that's great to be able to sleep well at that age. That gets harder and harder as we get older. But the day before Thanksgiving, when there was, 10 things to do by noon, very poor sleep.
Oh.
So I was like, oh, look at that. When like when you have a list of to-dos the next day, when you're thinking about this, and I got to get the turkey in by this time, I got to get that done. I got to, there's like a litany of things. It was amazing how it affected the sleep cycle.
Yeah, no, completely. That's a good lead in for like, what is the definition of like insomnia, right? So you could have moments of acute insomnia, which would be a sudden onset, some sort of a stressful trigger, a medical condition, and usually lasting less than 3 months. So for that person, they had a moment of acute insomnia.
Mm-hmm. Exactly.
Then there is chronic insomnia, which is defined as at least 3 nights a week for over the length of 3 months or over the period of 3 months. And this is insomnia in a general population, not specific to cancer patients.
And when you say that, what type of disturbance particularly? So 3 times a week for at least 3 months, and what qualifies as a sleep disturbance?
Okay, so what could be happening is there can be difficulty falling asleep, there can be difficulty staying asleep, and there can also be waking early. There's a fourth kind of insomnia, which is mixed insomnia, which would be any combination of those. And so it's not like you're stuck to one of those 3 categories. You can have difficulty falling asleep, and then once you fall asleep, you can have a hard time staying asleep, and then you wake early. So that, there's mixed insomnia too.
Right. Okay.
Some people might not necessarily consider that they have sleep issues because it is just so normal to them. Like, oh, well, I've always just slept this way, or, I've always had this issue. And so at the hospital, we used to use an evaluation. It's called the Epworth Sleepiness Scale. And it looks at different situations. And on a scale from 0 to 3, what is your chance of falling asleep during that? And so it includes like sitting down and reading, watching TV, being inactive in a public place, like at a movie theater. What's your chance of falling asleep? As a passenger in a car, lying down to rest in the afternoon, sitting and talking to someone, sitting quietly after lunch without any alcohol being involved, and then in a car while stopped for a few minutes in traffic. And so they use a scale to evaluate whether or not a person is having good quality sleep. So I'll pin that to the Pinterest page, and so people can kind of take the test for themselves.
That's really interesting. So this is basically saying how sleepy are you during the day?
Yeah.
So falling asleep in movie theaters isn't normal?
That's not normal, I guess. I mean, I guess it depends on the movie. But it's just, it's a really interesting evaluation because, you might laugh and be like, oh, sitting and talking to someone fall asleep, but
Sure.
that happens. That happens more often than not. And then I've experienced when I was going through treatment, driving home, and if traffic was bad, I would maybe doze off while the car was stopped. Never while I was driving. So I would actually take a longer route home because I knew that there wouldn't be any stops on the highway.
Oh, interesting.
Yeah. So I would actually go take the long way home because I knew I'd be moving the whole time. I didn't fall asleep while actually moving, but it was just, you're stopped because of an accident or at a light, and so.
Well, I'm only laughing because I've done both of those. I've fallen asleep in movie theaters just because it's dark.
Oh yeah, no, and you're relaxed. I know, I have too. I've done that too.
And I have a vivid memory of falling asleep in an actual theater while I was watching the play Waiting for Godot. It's very repetitious.
But I think being in a dark room, and usually you go to the theater at the end of the day. So
yeah, that's true.
It is. And then, I mean, we're all guilty of watching TV and falling asleep.
Mm-hmm. Yeah. So let's talk about some causes, or at least predisposing factors, things that lead to sleep disruption. I mean, we're talking in cancer care, there's a lot of things that are going on during treatment to disrupt sleep.
Right. And especially if somebody's getting their treatment inpatient. I mean,
yes. Hospitals are a tough.
Thank you, everyone who comes and wakes us up.
Yes.
To check on us.
The 2 a.m. blood pressure check and such. Yes.
I wanted to just, the first thing I always checked with patients who, when they would say that they were having difficulty sleeping, I would have the doctor or the nurse say, oh, this person's having a trouble sleeping, maybe you should give them some melatonin or something. And I would go through a history. I just want to clear this out of the way. Always consider pets that wake you up, your partner, and neighbors and sounds. So if you're telling your doctor, like, I can't sleep, and it's because you have a new puppy, like say, oh, I have a new puppy and it's keeping me awake. Normally I sleep fine, but now I have this new puppy. Because there were so many people where I would try to, I'd get this whole medical history, and then they're like, well, my partner snores and it keeps me awake. And I'm like,
Mm-hmm.
okay, I could give you all the stuff in the world, but we got to address the cause. And so I think
Right.
that's where, this kind of leads to, is like, sometimes
Yes.
there are external forces, and then sometimes there's an appropriate time to.
That's a good point. If you know what's kind of disturbing your sleep, because there's a giant dog on your bed and you're left to you're relegated to, 3 square feet on the edge. Yeah. I think that's, yeah.
Boundaries with Fido.
And that's true of the kitty cats too. They could like to come up, and they're nocturnal. So, by nature, they want to be doing something, but some of them do sleep through the night. But, I've had patients say the same thing. My cat does sleep on my head, and sometimes that affects my sleep.
Oh, I've jokingly been like, oh, my dog wakes up in the middle of the night at the same time. I'm like, maybe your dog needs some melatonin. like what I give you is not going to be the solution.
Okay. So with all of that said, if you look at causes besides what we would consider reasons to not sleep, causes of actual sleep disturbance are put under 3 major headings. There's medical causes, there's psychological causes, and then there's lifestyle causes. And so medical causes are things like allergies or reflux. So there's a condition in the background, or even a more chronic condition like hyperthyroidism could be diagnosed in some people and keeping them awake, because these are things that can disturb sleep or disturb falling asleep or staying asleep. Asthma, arthritis, and one of the classic ones, and I think something that people get very used to, is back pain. So they toss and turn because they're uncomfortable. And so chronic pain of any kind can keep you up at night. So finding a way to deal with the pain so that you're not tossing and turning. And it does wake people up. And again, this is something that people normalize, right? So they just tell themselves, I'm a sleeper that tosses and turns. But every time they are doing that, they might be waking up. And then sleep apnea, which most people know about today. I think it's talked about quite a bit, and there's commercials about it and that kind of thing. Sleep apnea can be undiagnosed, and often it's the person that someone is sharing bed with that notices that there's some sleep apnea. But there are ways to test that. And again, the Fitbits and Garmins and Apple Watches and things that people can wear to bed can sometimes catch that as well. And then there's a lot of prescription drugs, and those can be during treatment. That can be, like
steroids is the classic, right?
Steroids are tough, especially dexamethasone is a very strong, long-acting steroid that's used very commonly during treatment, and that's probably, one of the toughest challenges for us to control. The good news is most of the time, not every single type of cancer, but most of the time, it's not used perpetually. It's just during treatment time.
Right. And then if it is used on a longer term basis, typically they being the prescribing physician, recommends trying not to take that last dose after like 5 p.m. or something. That's kind of trying to take it earlier in the day. And sometimes you do take multiple doses throughout the day. But yeah, that's the biggest challenge to manage, is the steroid induced insomnia.
Yeah.
And there are other drugs also that can contribute to insomnia, like certain heart medications, allergy medicines, and antidepressants.
Yeah. And I know this might sound obvious once I say it, but I've had this happen more than once, is diuretics taken too close to bedtime.
For sure.
So be mindful of that. And so an important note with steroids or any drug should always go by the golden rule of minimal dose to get the desired effect, right? So that's the logical way to use drugs in general. And sometimes that can really help with sleep. But anyways, we're going to talk about treatments in a little bit. The last piece of medical causes kind of overlaps with a couple of things I already said, which is medical conditions and pain, and that is neurological conditions. So Parkinson's in the background, restless legs syndrome, anything that has kind of a restlessness to it.
Well, neuropathy from treatment, right? That can be painful. That can manifest as restless legs, someone who never had restless legs before.
Yeah. So all of those can add to sleep disturbance. So it's important to realize those are all medical causes. There's also common. We all know there's psychological causes, right? So depression, anxiety, or stressors. That's kind of encompasses most of what they are considered psychological causes. And that can be, like you mentioned, it could be acute or chronic. So that's another cause of sleep disturbance. Then lastly is lifestyle causes. So when someone doesn't exercise or they're sedentary, which often happens during treatment because there's other reasons to be tired between the treatment itself, things like anemia that happen during treatment, lack of exercise, being sedentary can be a cause of sleep disturbance. Having to change your shifts, like having to sleep not on a regular schedule, whether that's your work or, again, you're at the hospital and you're just not allowed to sleep through the night. Of course, that's going to be a problem. Not getting enough exposure to sunlight. So sunlight sets our clock, right? So we have this diurnal rhythm, and a diurnal rhythm means we sleep at night and we're up in the day, as opposed to a nocturnal rhythm, like those kitty cats, who have the opposite. So we need the sunlight. The sunlight sets our clocks, our internal clocks. And sometimes it's just eating too much, too close to bedtime, eating fatty meals, eating heavily, some poor sleep habits, not relaxing and winding down enough before bed. And this takes us into some things we can do, what we call sleep hygiene.
Okay, so sleep hygiene. It's creating an atmosphere, that's conducive to sleep. One thing we typically hear, which I'm sure people are going to be like, that's impossible, is limiting your screen time before bed.
Yes.
So whether it's your phone, your Kindle, your TV.
Now, can we just be clear? This is not impossible. It's just not what people want to do.
Right. But
yeah,
it's so ingrained in us to check our emails, to check our social media before bed, that for some people, it's very difficult.
And the reason that those screens are really bad is because of the blue light emission that suppresses our production of melatonin. So the screens themselves are emitting light wavelengths that then lead us to not create our melatonin, right?
Right. And I mean, light in general, I typically tell patients to start to dim the lights around the house around 8 p.m. And so turn off those overhead lights and maybe put on like a lamp, something that's a lower wattage, light bulb. I find myself doing that, turning off overhead lights, putting on the lower lights, and then my husband comes around and he turns on the hall light. I'm like, no, my melatonin.
It's funny that you say that, because my brain went straight to, yeah, but what if? It's exactly the scenario I went through in my head. And I'm thinking, also, there are these glasses you can wear that are called blue blockers. And the blue blockers do exactly that. They disrupt the blue light going to the back of your eye so that the lenses themselves can look yellow. But if you wear them, whether you're in front of a screen or you're in your house, you put them on at like whatever hour, a couple hours before bed every night, it does help you transition to mount that melatonin response that you need for a good deep night's sleep. So the blue blockers can be helpful for that. And if you are someone who gets up in the middle of the night, and I'm just going to say this now because I'm thinking of it, I don't know if it's appropriate or not, but if you're someone who gets up in the middle of the night and you need a nightlight to see where you're going, if you put a red light in, a red light will not reduce your melatonin production. So you could even get up at 1 or 2 in the morning, go to the bathroom, and you have a red light guiding you. It won't suppress your melatonin like anything with blue wavelength would.
So limiting that blue light, limiting and restricting regular overhead light, I recommend, and it's a challenge when going through treatment and even afterwards. But if a person tends to nap, to try to restrict the nap to being less than 30 minutes, because you're stealing. I don't know if that's the proper term, but you're kind of stealing from your nighttime sleep if you're getting really sound sleep during the daytime.
Mm-hmm.
And so just trying to limit those times, and I mean that's a huge challenge too, because treatment itself is so exhausting.
Yes. Yeah.
Fatiguing, I should say. It's fatiguing.
Yeah. The balance between napping a short nap and, knowing that it might affect that night. There's a balance there, right?
Mm-hmm. And like we said, like this sleep hygiene is kind of making your sleep area more conducive to sleep. So having that environment, having the cooler temperature in your bedroom, making sure your room is quiet, even using like a sound wave machine if there is noise from neighbors, making sure your bedroom, if need be, free of pets, quiet.
Mm-hmm.
Even like running a fan if you don't have like a white noise machine. And some people don't like the white noise machines, but just having like something like a fan running in the background.
Yep. Yep.
Whether for cool air because you're having hot flashes or just for that sound, making sure that your room is very dark. And oftentimes people will say, oh, my room is really dark. It's really, really, I've got curtains. But if you have anything like the light from a clock or any sort of electronic, any like artificial light coming through.
Yeah, I can't tell you how many times I have had, the way I ask it is this: can you see across the room? Can you make out the room across the way, right? Like how much light is really coming in? And a lot of people say they don't have any window dressings, even if they're living out in the country or something, there's no street lights or anything, but the moonlight is pretty strong.
Right.
So that's how I pose the question. Not is it dark, but can you see across the room? And are there any small lights? I don't care if it's a fire alarm, a computer that you leave running, or a router in the room, or whatever. Any little bit of light needs to be covered.
Right. Because when you first turn off the lights, everything does look really dark. But if you were to open your eyes in the middle of the night, what do you see?
Right. Right. Won't you acclimate to the dark? Mm-hmm.
Mm-hmm.
One of my kind of favorite prescriptions for people who like to take hot baths, speaking of kind of getting the atmosphere, I know we're going to talk about treatments, but we're talking about atmosphere. And I think this is atmospheric. Taking a hot bath with Epsom salt and just having dim light, or just doing a little light on a book and just relaxing in the tub with some Epsom salt and then going to bed.
Even taking a hot shower can be very relaxing.
Yeah. So it kind of goes into the whole like setting up the atmosphere to make sure that you're in the position to relax as much as possible.
Right. And oftentimes the recommendation is to keep your bedroom just for sleeping, which is not always possible, but to limit the time that you are actually in your bed, if possible.
Mm-hmm. And I'm going to answer the question of every listener out there. Neither Leah nor I are in our bedrooms as we record this.
No, but there is a bed in the room where I am recording this because it's used as a guest room. But again, that's not always possible. And so if you are in your bed at, for most of the day, kind of, again, creating this is my awake hour environment, and then dimming the lights, and this is my time to sleep environment. So for people who aren't able to be in and out of the bed throughout the day.
Right, right. So you're thinking when people are not well or they're going through treatment and they're in bed more often during the daytime?
Right. There are some what may be seemingly obvious things to address, like, restricting caffeinated beverages. So knowing what your limit is. And oftentimes people are like, I can drink coffee up until bedtime, but that may be somehow disrupting your sleep.
And I think that changes over time. I think that, sometimes what you could tolerate before, you can't tolerate now, both over time or over various health conditions that one might have, or medications that they're taking that change how you break down the caffeine or whether you break it down.
Absolutely.
The only way to know that is to experiment a little bit and say, well, if you have sleep disturbance and you drink caffeine, you could experiment with what time of day you drink it. Like, what if you don't drink it past 9 or 10 a.m.? And how do you sleep that night, as opposed to having a cup of coffee after your lunch, for example? And even decaf can affect some people. We say decaf, but it's not 100% decaffeinated. There's still, somewhere between 1 and 5% caffeine. So I'm saying that because I think that a lot of people are very protective of their coffee intake and might be in a very deep state of denial about how it's affecting their sleep. But the only way to be honest about it and be objective is to experiment a little bit and see what happens.
And it's a diuretic, like you mentioned before. And so even teas, they are diuretics. And so you may be waking up because you have to pee in the middle of the night.
Mm-hmm.
So making sure you pee before you go to bed is another good practice. Alcohol is another one, right? People have their little nightcap. They're having something to relax. Oh, this is part of my winding down process. Well, that can come back and bite you in the butt and cause you to wake up at night.
Mm-hmm. Mm-hmm.
Or have just poor quality sleep in general.
Yes, absolutely.
And then, in addition to some of the medications that we mentioned that can affect sleep, supplements can also affect sleep.
Mm-hmm. Yeah. So which ones are you thinking of specifically?
So some supplements that I think of is oftentimes patients take supplements that claim to be caffeine free to help with their energy, right? You're fatigued all the time and you're taking these, energy inducing type of supplements, or, it could be in like a powdered shake or something.
That often goes for supplements that people are taking because they believe that the supplement's going to help them lose weight. A lot of those will have stimulants in them as well.
Sure.
Some of them not so illegally, but yes. Buyer beware.
Those aren't called supplements.
Well, there's those that are blatantly illegal. And then there's supplements that sneak a little nip of this or bit of that shouldn't be in there and is not on the label. So one supplement I can think of that might not be on people's radar is anything with a aspartic acid in it. Because aspartate, now there's magnesium aspartate, there's minerals out there that are aspartate-based minerals. There's some other minerals, but magnesium aspartate is probably the one that people would take before bed thinking that they're doing themselves some good. But aspartate or aspartic acid is considered more of an excitatory amino acid. And on that note, that makes me think of excitotoxins. Now, this is not a supplement, but excitotoxins are found in junk food. This is the classic, what's on Doritos or Cheetos or, all these barbecue chips. A lot of them have excitotoxins, and they're called excitotoxins because they are working on neurotransmitters in the brain that are stimulatory. They excite the brain. So these excitotoxins make people want to eat that food because you feel better. You get this boost, but you don't want to be doing that. Well, you may not want to be doing it at any time of day, but you certainly don't want to be doing it at dinner time and thereafter. Yeah.
Right. So watch what your late night snacks are. Kind of like riffing off the Doritos thing, just eating lighter at night in general is helpful. So having a lighter supper, if you're going to have a snack at night, just make sure it's like more of a protein snack instead of something that is like really fatty, something that might come back to greet you in the middle of the night.
Mm-hmm. So, of course, that wraps up the sleep hygiene idea, which is foundational, is just trying to get good habits in place so that you can sleep well. But there's a lot of medications and a lot of conventional treatments for sleep disruption, which we probably should cover that before we go into what we would do as naturopaths.
So there are NCCN guidelines for sleep disturbances and insomnia, but they're more for survivorship. And I guess I should say what NCCN stands for.
The National Comprehensive Cancer Network.
Thank you. Thank you, memory. Brain fart moment. Yeah. And so that's available online. There is a patient download as well that can be checked out. I could put a link somewhere to that. So what I'll just do is I'll just cover the drugs, and it's going to be just a really superficial kind of review of the drugs that are available and what they are typically prescribed for in terms of sleep. And again, I'm not a pharmacist, so it is what it is.
So any pharmacists listening, take that with a grain of salt.
So for anxiety as the cause, typically there are benzodiazepines prescribed, like your Ativan and Xanax. The ones people most, think about for sleep is like the Ambien, Lunesta type things. Those are known as hypnotics, and those help with falling asleep as well as staying asleep. So you've got the anti-anxiety drugs, which help for that racing mind that might keep somebody awake. And then you have the hypnotics or the non-benzodiazepines, also known as Z drugs. And those help to both fall asleep as well as to stay asleep. These Z drugs are supposed to be used really between 4 to 6 weeks, nothing longer than that because of the potential for addiction. Mm-hmm. But there are some drugs like extended release or controlled released Ambien, and Lunesta is another one. And those have a reduced potential for abuse, and you can use those up to 6 months. Antidepressants can be prescribed for sleep as well, and they're usually prescribed at a much lower dose than would be for depression. One that's commonly used is trazodone, and it has a pretty good safety profile with a low chance of dependency or addiction. There are antihistamines. We think of things like Benadryl, and that's often the diphenhydramine, which is Benadryl, is combined oftentimes with like some sort of a pain reliever, right? Your Advil PMs, your Tylenol PMs. There also is an antihistamine that I think we've both seen patients taking, and it's for itchy skin, pruritus, right? And it's called Vistaril, and it also is sedating. So that's kind of nice because you're addressing two things. Because if you're having a lot of itching skin issues, which can happen with certain treatments, then this also can help you sleep.
Yeah, those combo drugs, or one drug that does two things, that takes away discomfort and helps you fall asleep. It's a nice dual action.
Right. So then there's like less risk of polypharmacy.
Mm-hmm.
When it comes to something like restless legs, then there are additional drugs like gabapentin is really common. Klonopin, Restoril is another one that those are prescribed kind of more specific for restless legs. And then kind of hopping back to those antihistamines, there are people who actually get restless legs from antihistamines, which for people who get chemo, they find out during their infusion, all of a sudden they start having the restless leg symptom. So that is one thing to keep in mind. We could do a separate podcast on things like restless legs, but yeah, there are multiple causes for that. And one of them can be diphenhydramine.
I was just going to ask you that. I was going to say, when you say people getting chemo, are we talking about the diphenhydramine that's often given alongside?
Yeah, the IV. Mm-hmm. Yeah, the IV Benadryl that they get can lead to restless legs. And so if someone's taking Benadryl at night to help them sleep, or because of allergies, and then they have restless legs, kind of,
right,
take a look and see if that might be part of the problem.
That would be sneaky.
Very sneaky.
Because maybe it was working until it wasn't working.
Right. Yeah. No, it's so interesting that how people react differently to drugs. Mm-hmm. So there's one more thing that the guidelines mention, and that is circadian rhythm sleep-wake disorder, which has to do with a mismatch between the sleep-wake cycle and light and dark.
Mm-hmm. Mm-hmm. Yeah. Some of the more recent work that's been done on this is fascinating. This whole idea of an inherent kind of gene-based, or at least hardwired wake and sleep cycle in people. Something called clock genes are in all of our cells. And those clock genes, the one that's most well known is something called periodicity 3, or the PER3 gene. But without going way deep into the DNA, if we pan back, it's basically that there are at least 2 types. And sometimes you hear about 4 types. But officially, in all of the research, we'll agree that there's at least 2 different types of people. Those who like the morning, and those who are more productive and more active at night. And so one way of characterizing that in the literature is a lark, or the morning bird, right? A lark and an owl. More recently, there's been a takeoff on that, and there's a 4-animal analogy or metaphor. I guess it's a metaphor, right? To represent different chronotypes. And the chronotypes, there is different ways that your body is, everything changes. The temperature of the body, the productivity, your sleepiness, even your digestive processes, according to your own 24-hour clock. And so who's the gentleman who wrote a book on this a few years ago?
Oh, what was his name? Breus, Bruce.
Breus, yes.
I think that's how you spell it.
Mm-hmm. In any case, he characterized 4 different chronotypes, and he named them after animals that have tendencies for a different diurnal rhythm. He has the bear, the lion, the dolphin, and the wolf, and all of us supposedly fit one of these in our tendency to use the clock, to use it for sleeping, waking, eating, productivity, thinking well, being sharp. And if you go online, you can find a lot of people are using this to say, oh, when should you hold your meetings? When should you be creative and productive? And when should you fall asleep? And when should you wake? And should I give you the characteristics of these? Are you interested?
Oh yeah, no, totally. No, because I took the test too. I took the test that I found, and it's fascinating. I have questions too after you explain. I've got some questions.
I probably do too. So at least half the population is what is called a bear. They sleep and wake according to the sun, and they feel most energetic during the daytime, have no trouble falling asleep at night, but do experience mid-afternoon slumps of energy. And again, that's, half or maybe more than half of the population. And then the wolves on the other side of this are night owls, and they go to sleep late and they wake up late in the morning. They have a hard time waking up. They like their nighttime time. I have found that this is a lot of artists in my life in any ways. They tend to be energized in the evenings, and they make up 15 to 20% of the population. And then there are those that are called a lion, and these are the early birds. They wake up early. They wake up energized, but then they're tired by early evening as well, and they go to bed early. So they wake early, but they go to bed early. So they're getting their proper amount of sleep, and they make up 15 to 20% of the population. And then last but not least is the dolphin. And the dolphin are light sleepers, and they have kind of trouble following any routine schedule. And these tend to be people who do have insomnia issues. They have a really hard time creating and training their body to a normal sleep-wake cycle. And they wake up a lot in the night, and they make up 10% of the population, or so they say. Now, how deeply rooted in research is this? Honestly, I don't know. I didn't read the book, and I haven't looked at the primary literature, which is usually where I go to verify such things, but it sure is fun.
No, it's cool. Because I took the test. So did you take the test as well? Right?
I did.
And, may I ask what you are?
Well, yes, you can. I am a bear.
Interesting.
Yeah, definitely sleep and wake according to the sun. I will not argue. I took this online test, and then I looked at the bear. I was like, yeah, that's about right. I don't have any trouble falling asleep. And I don't know about the mid-afternoon slumps, but, as you and I both know, recording after about, 3 p.m. is off. That is not an option.
Yeah. I think wasn't it like a lighter work schedule was recommended for that period of time? At least I know for myself, who is a lion.
Uh-huh.
I'm a lion. But my big question, you might not know the answer to this, but can you change? Because I think when I was younger, I was more of a wolf. And I don't know if that was my lifestyle that put me in that when I was the artist. Or if even if you think about children, right? Because teenagers tend to kind of be really draggy in the morning, and yes, they need more sleep. So I just wonder, do you also have life cycles?
There is. From what I've read, prepubescent children tend to wake up early. By the time puberty and adolescence sets in, tend to wake up late. And we always, blame large amounts of melatonin for the, 10 and 12-hour sleeps of a teenager. But it really is something that's normal for that age. And then as we get older, of course, there's less sleep needed as one ages. And so most people over a certain age just can't get 8 hours a night. They'll get 7 hours or 6 hours and function on that. The key is, how do you feel, right? So,
right.
But yeah, to answer your question, the entraining of our circadian rhythm is somewhat hardwired, but it's also influenced by our environment. When we sleep, when we're exposed to light and dark, stimulations around us. So I'll call that soft wiring, since I called the gene hardwired.
I think it's fascinating, and I'll put a link to the test. So if other people are interested in finding out what their chronotype is, then they can check that out.
Indulge. It's fun. It's like I don't know. Growing up, it was like Cosmo, right? There's always quizzes.
Yeah, the Cosmo quiz.
Hopefully it's a little bit more legit than that, but I'm just saying that's what it reminds me of.
A little less risque than that.
For sure.
Ooh, my stomach's growling. Okay, so we chose the subject insomnia because we thought it would be a lot shorter than our previous topic of bowel changes, and we're kind of running long. So
yeah,
why don't we we'll just kind of wrap up this episode, and we will talk about the rest of this we'll do a part 2 to this.
We get to talk about plants next, and herbs and supplements, right?
Yeah. We're gonna kind of talk more about the integrative stuff. So we're saving the real fun stuff. We led in with chronotypes, and people they're a captive audience now. And then we're just gonna move on to plants and supplements and all the other kind of fun things.
Yeah, there's so many things to be done and so many lovely plants to learn about. So it'll be a good one.
Awesome. And on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this has been the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.